Bonjour tout le monde. The drugs covered in this unit inhibit bacterial protein synthesis by binding to and interfering with ribosomes. This means translation is inhibited, and most are bacteriostatic. So think of a typewriter with a paper jam. We'll have a recurring ribosome typewriter throughout these sketches to highlight this bacteriostatic mechanism of action. There are a couple that are bactericidal, and we'll make that distinction in their respective sketches. Well, on that note, let's say bienvenue to tetracyclines, which include doxycycline and minocycline. They will be represented by cyclists competing in the most famous of all cycling races, and the reason why I'm practicing my French phrases, it's Le Tour de Cyclines. Witness the passion, the conviction, the grace, the unsightly enamel dysplasia. It's all on display in this venerable competition. Our sketch takes place during a final climb in the French Alps. It's the end of the first stage, and they're announcing the leaders. First, let's go over mechanism of action. Tetracyclines work by entering microorganisms and concentrating inside the cell. Once inside, they bind reversibly to the 30S ribosomal subunit, blocking tRNA binding and halting peptide formation. This will be represented by a French reporter at the scene typing furiously about today's results. Notice that his typewriter looks kind of like a ribosome. He's trying to translate today's announcements, but he's hindered by a paper jam. Whenever you see the typewriter, think bacteriostatic. And if you take a closer look, it seems our leader beat a Tour de Cycling's record by just under 30 seconds. The reporter frantically checks his timer in disbelief. C'est incroyable! Whenever we want to highlight a 30S subunit, we'll have a timer or clock showing the number 30. The only other antibiotic where this is the case, as you will see, is aminoglycosides. Tetracyclines are broad-spectrum antibiotics, with activity against many gram-positive and gram-negative bacteria, including MRSA, Rickettsia, and atypicals. So take a look at the podium. To symbolize this broad spectrum of activity, our current second and third place cyclists have accepted their awards, a crystal prism that's creating a kind of broad spectrum rainbow. The leader at the top of the podium will represent tetracycline's activity against MRSA. A long-acting tetracycline, such as doxycycline or minocycline, is a reasonable antibiotic of choice in the setting of MRSA with known susceptibility to this agent. In previous sketches, MRSA is always associated with a merciless golden staff-wielding pharaoh, and in an odd and certainly passé display of Egyptomania, our victor is wielding the first-place gold staff aureus, and being crowned with our MRSA-evoking pharaoh's headdress. A fan cheers him on, who's either holding ardent words of inspiration or a horribly misspelled no thank you. MRSA? Non merci. No mercy is our slogan that reiterates MRSA coverage. This may be low yield on an exam because if a question points towards the empiric treatment of MRSA, in more serious infections, drugs like vancomycin, daptomycin, and linezolid will be your go-to big gun antibiotics of choice. Tetracyclines, however, are often the drug of choice for a variety of atypical pathogens, including Rickettsia species. Remember, rickettsial diseases like Rocky Mountain spotted fever are arthropod-transmitted diseases, often consisting of fever, headache, myalgias, and rash. You know, like in that one outdoorsy patient who frequents areas with tall grass. Prime tick territory. Well, let's explore the wooded area off the side of the track. And dans le bois, what seems to be a harmless and friendly deer, is actually harboring an extensive and not-so-friendly tick infestation. Let these ticks remind you that tetracyclines, namely doxycycline, are not only effective in treating rickettsial disease, but numerous other tick-borne diseases. This includes ehrlichiosis, transmitted by the Lone Star tick, tularemia, caused by Francisella, and even early or disseminated Lyme disease, caused by the infamous Ixodes tick. In fact, doxycycline is used to treat a variety of zoonotic diseases as well. So think of it as the drug for the great outdoors. Le grand air. Brucellosis, the most common zoonotic disease worldwide, is often transmitted to humans through domesticated animals, such as Bruce the cow here. And this sheep with the Q-shaped horns should remind you of our previous Coxiella sketch. Coxiella causes Q fever, which can lead to culture-negative endocarditis, which is treated with doxycycline. Notice his rusty heart-shaped bell. See these ground squirrels? Cute, right? Don't you just want to pick one up and name it Remy and take it home with you? Well, it's harboring the plague caused by Yersinia. Take a tetracycline and put the squirrel down, okay? We've gotten a little off track here, pun reluctantly intended, so let's revenons à nos moutons and illustrate a couple more important atypical pathogens covered by tetracyclines. Mais oui, mon ami, le français, the language of love, and love, the language of chlamydia. Doxycycline given for 1 week is a first-line agent in treating chlamydia, urethritis, and cervicitis. If you take a look at our cyclist heading towards the finish line, you can see our recurring clam symbol for chlamydia incorporated into the bike seat. Another infection to keep in mind is pelvic inflammatory disease. When cervical infection, such as chlamydia and gonorrhea, is untreated, these bacteria can ascend to the upper genital tract and cause pelvic inflammatory disease, also called endometritis if it involves the uterine lining. So, on an exam, always think of an antibiotic regimen that targets chlamydia